Hello, my name is Don Tatalovich. I'm the owner of Cornerstone Dental Center. And I just wanted to talk a little bit about my background and what, for me, how that's impacted, our team here and how that being a veteran-led team interfaces with dentistry. So my background, I grew up in northern Wisconsin, up in the woods, and then after that attended college and grad school in the Midwest. Following graduation from grad school, I enlisted in the Navy and then was out in San Diego for about 6 years as a rescue swimmer there. And so, I guess the second piece would be how does that military service impact our office here and my leadership? I think that for many of the people you talk to in the military, the things that they'll tell you are, I think that helped expand my life experience and helped shape my worldview some. I think that it also, with that experience in a dynamic environment, helped with decision making in dynamic environments. And that was something that was quite a bit different from an academic setting for me. And then just general leadership skills. I think that military service helped to continue refining those leadership skills. When it comes to dental emergencies, why is leadership so important? And why is our experience so important? So I think that when it comes to any sort of urgent situation, I think that a lot of us find that we tend to fall back on the training that we have and the experience that we have. And so knowing that, I think at our office, we work really hard to be prepared and to make sure that we have the training we need to address urgent situations, including dental emergencies. At Cornerstone Dental Center, what are some of the emergencies that we have seen or we do see here in Hayden? I think we see a variety of different emergencies. I think it depends on the week. But for the more common things that we would see would be broken fillings, maybe broken or lost crowns, fractured teeth, teeth that have developed an infection for whatever reason. Sometimes, we'll see patients. This last week we saw a few patients with broken implant crowns. And so as people go through a number of different treatment modalities in their life, and as that's even expanding the treatment options that are available to patients, we need to know how to repair those things and then provide a solution for patients. How does military service, how does being a veteran, how do my experiences inform how our team moves forward and handles urgent situations? So with our team, we work really hard to be prepared for the types of situations that our patients present with, the types of emergencies that our patients have, and the things that we might see in dentistry. I think that kind of leads into the I guess privilege that we have here at our office of having a lot of very experienced hygienists, experienced assistants, and experienced staff at the front office. So for instance, our front office staff, they're able to, having been in the assistant role, worked in the back, they're able to triage a little bit over the phone and figure out what exactly is going on with a tooth or an area, and start to give you some idea of what you can be doing already to help the situation. The other thing that we do is, again, with that cross-training, communicate well. And so being able to pass information along from front to back, from the clinical area to the admin area, to be prepared for you as a patient, and then to make room in our schedule for you so that we can see you as soon as possible. What systems or training do we have at our office in place to ensure that dental emergencies are handled calmly and effectively? So with our office, we have the benefit of a small staff, a small office. And so with that, communication is really efficient. We're able to communicate quickly and efficiently from the clinicians in the back, the hygienists, the assistants, and the doctor to the front where the administrative staff are taking phone calls and helping patients triage. I also believe that with the cross training that our office staff have received, our front office is very knowledgeable about the types of procedures that are needed, or the symptoms that a patient might be experiencing, and they can help to inform the patient more, even on that first phone call. I get an important question that would come up in my mind then would be, if I'm a patient and I'm experiencing a dental emergency, what do I do next? What are my next steps? So I would encourage you to give us a call. Call right away and let us know that there's an issue. As you speak with our front office, they'll start to be able to help you, as they discuss the symptoms with you, maybe triage what you can be doing to make the situation better, and then we'll start to talk with you about how soon can we see you, and when can we get you on our schedule so that we can take a look at things and come up with a game plan. What's a piece of advice that I would like to give patients who might be experiencing a dental emergency? And so maybe easier said than done, but please do your best to stay calm. With a dental emergency, stay calm, give us a call. We'll start to try to triage and sort out the situation over the phone. As we're speaking with you, we'll also start to schedule a time with you where we can see you as soon as possible. And then once we're able to get you in, take a look at everything, we'll come up with a plan and we'll find a solution. For patients that might be experiencing pain or discomfort or having more of an urgent issue, what are your next steps? Please reach out to us. Give us a call. We have other avenues, email or texting. Get in touch with us, please. Send us a message. Once we're able to speak with you, we'll come up with a game plan. We'll get an appointment for you, and we'll find a time where we can take care of your needs.